Most people carry a quiet assumption about health data. If it's medical, it's protected. And if it's protected, it's safe. And if it feels safe, you don't really need to think about it. That assumption wasn't unreasonable for a long time. When you talk to a doctor, your information stayed inside a tightly regulated system. Hospitals, insurers, and providers operated under strict legal rules. Access was limited, the use was constrained, and any violation had serious consequences, real world consequences attached to it. Health data felt different from other kinds of data because structurally it was. But over the last few years, that structure has been changing. Health data stopped living only inside hospitals and insurance companies, and it started to flow into consumer tools, apps or platforms, assistants, fitness trackers, nutrition apps, mental health services, and now general purpose AI. What's being asked of people today feels small, right? Upload your labs or connect your portal. Let me remember your history so I can help you better. Each step on its own makes sense. But when taken together, something important changes. We're no longer using tools to look at just the health data. We're being asked to centralize our health context. Not a single result, not a single appointment, but literally to as the highest degree possible everything. And that's where this episode starts because once that shift happens, the rules people think are protecting them are not always the rules that actually apply. Now, before criticizing this shift, it's important to acknowledge why it's happening. Modern healthcare is undoubtedly fragmented. Patients juggle multiple portals. Lab reports are dense, they're technical, appointments are short, follow ups, if they happen, they're oftentimes limited. People leave offices, they really do. A lot of times they're confused or anxious or they're unsure what actually matters. So when an AI system offers to help, the appeal is obvious, right? An AI system will say to you, upload everything. I can summarize your labs. I can help prepare questions for your doctor. I can track patterns over time. I can explain this in plain language. These aren't reckless promises, right? They're not. They're what they are is that they address real pain points. In fact, this framing is explicitly how tools are described by the companies that make them. OpenAI, in announcing ChatGPT Health, emphasized helping users understand medical information and prepare for clinical conversations, not replace doctors, right? Anthropic has made similar statements about Claude for healthcare, repeatedly stressing it is an assistant, not a clinician. At face value, this is a reasonable evolution. The problem is not the stated intent. The problem is what changes structurally once health data moves into consumer AI systems. Most people believe a single word here is doing all the protecting: HIPAA. But HIPAA is not a universal shield that follows health information wherever it goes. HIPAA applies to covered entities and more specifically healthcare providers, insurers, or other business associates operating under formal agreements. It does not automatically apply to consumer apps, general software platforms, AI tools that you voluntarily upload your data into. Now, if you take information out of a protected healthcare system and you give it directly to a consumer platform, the legal governing framework, the privacy of your data, that can change. And it's not a loophole, right? This is how the law was written for different reasons, but that's how it was written. The data still feels medical, the interface still looks clinical, but the protections people assume are there may no longer apply in the same way. This is not theoretical. OpenAI's head of health had publicly stated that HIPAA does not apply to consumer facing ChatGPT health features in the same way it applies to clinical systems. Once you cross that boundary, your data is governed by consumer privacy laws, the FTC, and company policy, but not healthcare law. That boundary is invisible to most people. And this is where the system level shifts happen. A product starts by doing one useful thing, right? It's explaining labs or tracking your nutrition, helping with symptoms. Then it adds memory, history, trends, context. Then it adds integrations, wearables, patient portals, uploads PDFs, your pharmacy data, what medicines you're taking. At that point, the product stops being something you use occasionally. It becomes where your health context lives. And now, this is not about manipulation, right? This is about the gravity of the situation. Once data is centralized, once your health information is centralized, switching away becomes harder. And once switching becomes harder, the retention for these companies improves. And once the retention improves, the data itself becomes strategically important from a business perspective, even more so than before. Now, this pattern isn't unique to healthcare. It's the same reason email providers or cloud storage or financial apps become sticky over time. The difference is the sensitivity, the gravity of what's being centralized. Health data isn't just descriptive, it's predictive. It says something about who you are, what you might need, how risky you are in the future. And that's where the incentives behind all of this start to matter. And if this still feels abstract, it helps to ground it in maybe an example from history. In 2023, the U.S. Federal Trade Commission took action against a company called BetterHelp, a large mental health platform. The FTC alleged that BetterHelp shared sensitive health information with advertising platforms like Facebook and Snapchat, despite promising users that their data would remain private. Better help enforcement was just one example, right? This did not involve hospitals, it didn't involve insurers. It happened inside the consumer health app space. This is exactly the category where HIPAA protections were assumed by users but did not apply in practice. This case is one reason that the FTC expanded enforcement of the health breachment notification rule, explicitly targeting the consumer health platforms operating outside of HIPAA. It's not speculation about what might happen. It's a response to something that already has happened before and will almost inevitably happen again. At this point, though, it's important to be precise. AI companies involved in healthcare consistently state, right, that they're not doctors, they're not making diagnoses, they're not replacing technicians, clinicians, they're not doing any of that, and they're implementing safeguards. Anthropic has stated that health data used in its healthcare features is not used to train models. OpenAI emphasizes safeguards, partnerships with health intermediaries, and responsible use frameworks. There's no evidence to be clear that these companies are currently selling any of your health data to insurers or advertising, and saying otherwise would be inaccurate. But policy statements describe what's happening now, not what must happen forever. And that distinction matters. And this part is where I want to take a little bit more caution. It's appropriate to do so, not because the risks are explosive, but because they can be incremental. And I want to focus on just two realistic scenarios, not some kind of worst case Armageddon AI fantasy, right? And this first scenario, there's regulatory drift and reclassification of HIPAA, and it was originally written for a healthcare system that did not include these general purpose AIs acting as platforms for your personal health hubs. But as these tools become normalized, pressure will build to reinterpret or adjust regulatory boundaries, and the power of the lobbies is not a small one. We've seen this before in other domains. Data that was once tightly regulated becomes partially exempt through reclassification or carve outs or new categories of use. If consumer AI platforms remain outside HIPAA while holding increasingly comprehensive health context, that data exists in a regulatory kind of gray zone. No laws need to be broken, only reinterpreted. At that point, these protections that we take for granted, they weaken, not through malice, but through a mismatch of old rules and new systems. Let me give you another scenario. This is about secondary use without direct sale. The second risk is a little bit more subtle. Health data doesn't need to be sold directly to create downstream consequences. Instead, it can be used to build models or classifications or risk signals. Those signals can be shared, licensed, or embedded in partnerships without ever transferring the raw medical files. This pattern already exists in advertising, finance, and insurance. The question isn't so much about who is my health information being sold to, it's more about what conclusions are being drawn about me. Where do those conclusions go? Who gets to act on them? And once insight exists, controlling their spread becomes much harder than controlling raw data. That's really one of the systemic risks. Now, to be clear, this is not a call to reject AI in healthcare. Not fundamentally 100%. AI can genuinely help people understand their records or prepare for appointments or spot trends that they might otherwise miss. This isn't about don't use it. This is more about don't use it passively. Know when you're inside a regulated medical system. Know when you have stepped outside of it. Know what assumptions you're carrying with you. Health data feels sacred because historically it was treated that way. And as it moves into these new systems, that protection is no longer automatic. And the most important safeguard isn't fear, it's awareness.